Hello to everybody that's joining us. And I am Lisa Monroe, the Director of the Tompkins County Office for the Aging. Thank you for joining us today. I just want to give you a little background about our process, our age-friendly process. In 2014, Tompkins County led the efforts to apply to participate in AARP's age-friendly network of communities, age-friendly communities. COFA initiated this effort as a direct result of stakeholder input and recommendations made through consensus conferences that we held. In 2015, Tompkins County and the city of Ithaca were accepted into AARP's age-friendly community network. In November of 2019, Tompkins County was one of 3 counties in New York State awarded a grant from Health Foundation of Western and Central New York to support the development of the Age-Friendly Center for Excellence. This initiative is designed really to help communities and local governments incorporate healthy, age-friendly principles into relevant policies and programs which directly benefit the community. We've already completed 2 workshops in this 4-part virtual workshop series. The recordings can be found on a website link, which will be provided in the chat. Today is our 3rd workshop, and we have our final workshop in May. I'd like to thank Dominic Recchio, Communications Director for Tompkins County Admin, who helped us make this virtual workshop possible and provided technical assistance, and he will provide that throughout the session. Also, our Age-Friendly Steering Committee, our core team, who has worked on planning this workshop series, Karen Bullis, Terry Reineman, Esther Greenhouse, and Vanessa Wagner. This workshop will be recorded and uploaded to the Tompkins County YouTube page. Please use the chat box to ask any questions or provide any feedback. We will attempt to answer questions in the chat, but we will also provide time during the Q&A. Today's session is entitled Planning for Age-Friendly Communities, Resources for Local Governments and Community Members. And our presentation is jam-packed with fantastic presenters. It's a great group today, and I will hand it over to Esther Greenhouse, our Strategic Director of the Center for Excellence, to get things started. You there, Esther? I think you might be muted.
Good morning, everyone. Thank you so much for joining us today. So today's focus is on understanding the role of zoning and planning in developing age-friendly communities. And if we look at today's agenda, Paul Bayer, the New York State Director of Smart Growth Planning, unfortunately is unable to join us this morning, but we do have a crucial local resource. Joan Jerkowicz will be joining us to discuss what is smart growth and how does it relate to age-friendly communities and the executive order in our county. So I'm going to turn it over to Joan, and then we are going to discuss visitability. So that is a concept that can make our housing and communities work for the lifespan, and a large body of work that was done by a team at Cornell University under the direction of Dr. Mildred Warner. And then hearing from 2 local advocates and how they've been applying this at a grassroots level in the town of Caroline. So Joan, I'm going to stop sharing and allow you to take over. Thank you.
Thank you, Esther. And let me get going here. There we go. So again, good morning, everybody. I'm going to be talking a little bit about age-friendly communities and how they relate to smart growth and to other related planning concepts. Again, my name is Joan Jerkowicz. I've been a planner for 40 years and been working in Tompkins County for the past almost 30 years. So you may have heard the term smart growth, but if you haven't heard that term, you may have heard similar terms. Sometimes it's called nodal development. Sometimes you hear the term new urbanism. In Tompkins County, we talk about development focus areas. But no matter who's talking about it and what term they use, we kind of share a certain sense of certain criteria that apply in all those cases. In these cases, we talk about having mixed land uses located in a compact design, which helps create walkable neighborhoods. And then within those neighborhoods, we have a range of housing choices, and we develop a strong sense of place. But what do these terms really mean as we work on the planning process? So mixed land uses means building homes, offices, and other development types near one another, whether it be on the same block or sometimes even within the same building. But what it means is it draws people to the area. There's activity all day long. Visitors come, people come to work even if they don't live in the neighborhood. So there's a lot of activity. So there's a sense of safety in the community throughout the day. And it also makes the area attractive for businesses. It helps to support local businesses because there are people there all day to take advantage of the business. By compact design, we mean taking advantage of existing communities. And there's a couple of ways to have compact design within existing communities. One is to use infill development, which means building on the vacant lots and the underutilized areas within the existing community. And sometimes it means building up rather than out. So adding more height to buildings is another approach to infill development or to compact design. But having a walkable neighborhood relies on those two aspects, having a mix of uses and having a really compact design. So it's easy to go from one place to another, not just for the physical activity of walking, but with a purpose, whether you're going shopping or you're going to school. But walkable doesn't mean just it's close. You have to have the facilities that support it. So just sticking in a sidewalk along the street is not an inviting walking environment. Painting a stripe on a road does not make it a bike-friendly street. You really have to think about how the design aspects fit together to not make it possible to walk, but make it an attractive alternative. In general, people are willing to walk up to 10 minutes before they start thinking about driving to a place. That means for a able-bodied person, that's about a half a mile distance. But for people with mobility challenges, whether that be someone in a wheelchair, someone who just doesn't walk fast, whether it's someone has a stroller and a toddler walking along with them, that distance is much smaller. And we have to design for all of those possibilities. Now, I talked about a range of housing choices. It's not just about having a number of housing units within an area. It's about having a variety of types of units in the area. Available to people with different incomes, available to people with different housing needs. And the thinking here is you want a community that allows someone to live their lifespan within that community. So maybe you've drawn to a community when you're just starting out and you're young and, so you're really just looking for a one-bedroom apartment to rent, or maybe a house that you can share with a couple of other people. Over time, if you develop a family, you want to move into a bigger place with more bedrooms. Again, it would be nice to be able to do that in the same community, because that's where we've developed our connections, our community connections. We know where the doctor is. We know where our friends are. We know where to go get a cup of coffee in the middle of the day. That's the community we want to stay in and live in and not have to reestablish ourselves every time our life changes. So again, you can go from starting out, building a family, and then when the family starts to leave, maybe you can find a smaller house in the same neighborhood where you can live. And even when you get to the point where Maybe you can't live alone anymore. It would be nice to have supportive housing, again, in that same neighborhood where you have the connections and you have the long-standing, just life choices you made in that same community. And again, there's one more thing. It's not just about having the physical environment. It's not just about being able to stay there your whole life. It's about having that sense of place. It's not necessarily that you have to live in the same neighborhood all the time, but you want a place where not only is there's a good physical form, but there's lots of social activity. So again, whether a neighborhood has a sitting area or a footpath, um, or some public artwork or a park that just draws people to it, where people can interact, talk, and feel welcomed in the community. And if that's tied to some more formal or less formal social activity, all the better. So if there's a coffee shop, so you can just sit and have a cup of coffee, not just sit. Or if there's a playground nearby where you can see children and interact with other parents, or even something more formal, like where there are festivals and parties. Again, all that leads to that sense of place in the community. And when we develop communities that are one thing and one thing only, you just can't develop that sense of place as well and as easily and as organically. So in Tompkins County, we talk about development focus areas. In 2012, we developed our development focus area strategy for the county. It's about identifying, again, some of these smart growth principles and where these things have already started to happen and where we can build on them. In the development focus area, we have identified 4 different kinds of focus areas. Again, not every place is the same. Everything's going to have a little different feel. So we've identified an urban center, which includes the city of Ithaca and most of the surrounding areas. We've identified 5 what we term established nodes. These include 3 of the villages that are located outside the urban area, as well as 2 of the larger hamlets in the community. And we've identified 8 rural centers. The Ithaca area urban centers, the historic center of the community, it's where our major government functions, our major retail opportunities are located within the Ithaca urban center. This is also an area that's served by a dense network of transit services, so you can easily go from one location to another within the urban center using the transit system. Now, nodes, whether they're established or emerging, are walkable in size. We've already talked a little bit about that. And these established nodes are already there. They already include a mix of housing types, different kinds of businesses and services, and there are employment opportunities within these areas as well. In Tompkins County, as I said, these include 3 villages and 2 of our hamlets. In addition, these areas, very importantly, have a complete water and sewer infrastructure system. They have both services. In addition, they are tied by transit to the urban core. So you can get between the 2 at least several times a day. Now, emerging nodes really don't quite meet the definition of an established nodes. Largely, they don't have that mix of land uses that would make them established. But they do have some of the water and sewer infrastructure in place, or at least plans for providing that infrastructure. Again, in Tompkins County, we've identified 2 emerging nodes. The NYSEG area, located out on Route 13, near the old NYSEG office building, and South Lansing. And lastly, we've identified 8 rural centers. Like nodes, these are walkable in size and scale, but they don't have the same mix of land uses. They tend to be way more residential in nature, and they do not have the water and sewer infrastructure that would support the density and mix of uses that we would like to see in a node. However, they do serve an incredibly important purpose. which is they provide services to the surrounding rural area so that people don't have to travel all the way to the urban area or to one of the villages to get services. There are services located in these nodes. So now that we've had this development focus area strategy in place for the past 8 years, what kind of progress have we made? Well, we have several sources of funding that are tied to projects being located within one of our development focus areas. Our Community Housing Development Fund makes special provisions for projects that are located in the development focus area. And virtually all the funding that we have, it's not an absolute requirement, but certainly the lion's share of the funding we've provided through that program have gone to projects within one of our development focus areas. In addition, the Tompkins County Industrial Development Agency has developed 2 funding programs in partnership with local governments, again, to promote development within nodes within these focus areas, one with the city of Ithaca and one with Lansing. And we are starting to see changes in development patterns. Historically, I won't go over the history, that's boring for a lot of people, but we are starting to see a change in where development is happening in the community. For the last 2 full years of data that we have, about 85% of new housing units have been built within our development focus areas. And somewhere between 50 and 75% of new non-residential development has happened within our focus areas. I think that's about my time. I'm going to stop now and happy to answer questions when we get to the question and answer portion of our show today. Hello?
Joan. Thank you, Joan. That was really informative. I
Sorry, it felt
appreciate that.
very rushed. Lots to say.
Yes, no, it didn't feel rushed and it was really informative. We appreciate that. So now I'm going to share some information about the concept of visitability for those of you who were in who watched our previous workshop number 2 on the built environment. We talked about the role of housing and design in our communities. For those of you who haven't seen our previous workshop webinars, you can find the recording links on our website. So in terms of changing your housing stock, what options do we have and why do we have a need to change the housing stock? So firstly, there's a concept of visitability, and visitability grew out of the disability rights advocacy movement. And the notion is that can a person who has a mobility disability, so they use a wheelchair, they use a walker, they use a cane, they're unable to do steps, can they come to your home to visit for a meal, just for a visit, for a holiday event? And the answer for the majority of the housing stock in our country is no. People with those specific needs are not able to visit most homes in this country. And so by just the way we've designed and built our housing, we have designed out a significant portion of the population. Now, part of the issue is that we tend to see people who fall in those categories as siloed from the rest of society, that they're not a part of the fabric of everyday life. And the notion that perhaps it's too difficult to meet their needs. But if you think about what we're talking about, we're really talking about access to a home without steps for a variety of reasons. So if we widen the lens because we're thinking that maybe persons who use mobility devices are really a tiny subset and we just can't accommodate them. What we really need to think about is under what other circumstances would a home benefit from having a zero-step entry like the one shown here. So in terms of the zero-step entry, we have to think about it's not just my 90-year-old mom with her walker accessing the home, but it's also when I'm trying to wheel in a child sleeping in a stroller and not wake them up, or the boomerang children who are moving home periodically. They moved home for the pandemic. They may move home between jobs, trying to move in furniture and so on. So there's a lot of reasons that we would want to have what are called visitable features. So visitability advocates for at least one zero-step entry to every residence, that within the home, there's at least 32 inches wide of clear space at doorways. And this is crucial if I am using a mobility device or if somebody's helping me. It's also quite a help if you're carrying a sleeping child, if you're carrying groceries in the house, if you're carrying a laundry. And throughout the main floor of the house, we want a 36-inch wide clear path with no level changes and at least a half bath on the first floor. Now, around the country, a lot of municipalities have looked at incorporating visitability. So they want to shift their housing stock so that more housing stock has visitability features. So it's not only working for your relative who might be coming for a holiday meal, it's not only working better for you under all the behaviors I just described, but it's working well for anyone who lives in that residence across the lifespan. It's making our housing stock more user-friendly, more appropriately designed for all the people across the lifespan. So I want to mention an example. Cortland County, the city of Cortland a few years ago passed a visitability resolution. And I know that their focus was to try to have a positive impact on the housing stock in the city. And I really commend them for doing that. But there are a couple of important things to know for communities that are looking at shifting their housing stock. One is that a resolution is not an ordinance, so it doesn't carry the same weight or the same impact. Other things I'll point out on the screen that the text that I'm showing is wording from the resolution that talks about how it applies to new single-family dwellings and duplexes which receive any public funding. So now we're focusing on a subset of the overall housing stock. It's only housing, that receives public funding. So the other issue is in the next paragraph, it talks about that the following requirements shall be the recommended design requirements of new publicly funded housing when it is determined at the discretion of the city grants administrator of community development funds that such requirements are feasible. So the big question is, does that make sense? Is the grant administrator the appropriate person to do this evaluation? What information are they getting from the building department and zoning and planning? I'd like to show you another example of an ordinance. This is considered one of the hallmark ordinances regarding visitability, universal design, and creating housing for the lifespan. It's from Pima County, Arizona, where they enacted an ordinance to require that all homes have visitable features in terms of new construction. And over the course of approximately 10 years, over 20,000 new housing units were built with these features. Now, these housing units would have been built regardless, but now we've added 20,000 new housing units to the housing stock that actually work for the lifespan, because it's important to recognize that the standard of what we design and build does not work for people across the lifespan. So what Joan spoke about earlier in terms of having a community where you can spend your lifespan, the housing stock is often a major barrier to that. So lastly, I'm just going to direct you to a resource that is available through the American Planning Association, the Aging and Community Policy Guide. For those of you involved in zoning and planning, please access this resource. And if you have any difficulty accessing it, you can reach out to me. I'll put my email in the chat. So now I would like to check in. Paul, are you available to present? It looks like Paul Byer was able to join us after all. So bear with us. We're very happy that Paul was able to join us. I know there's a lot of demands on his schedule. Paul, welcome. Thank you so much for joining us this morning.
Well, thanks for having me. Sorry, it was not a good morning for technology. Sorry, I'm late, and I just figured out how to unmute on Zoom. So I learned something new.
Great, thank you. So do you have any slides for us? Or
no slides. I was just gonna.
That's fine. That's fine. Then I'm going to mute and I'm going to turn off my video and I'm going to turn it over to you.
Okay, great. Well,
Thank
great to talk to everybody. And it's always wonderful to work with Tompkins County. My smart growth division here at the Department of State is engaged with Tompkins on a number of different issues: climate mitigation, climate resiliency, and of course, age-friendly New York. It's very productive county in terms of planning, but also planning for different disciplines like aging and climate change and such. So I'm happy to talk today about what we're doing on the state level with the Age-Friendly New York and the Health Across All Policies executive order and program. We, of course, handle aging and health together at the same table, which I think is very productive because the different parties and the different issues sometimes overlap and sometimes they don't overlap completely. So it's an opportunity to collaborate and cross-pollinate, bringing those two disciplines together. I am going to talk primarily about the executive order, as I mentioned, but there really is what I find a very fascinating governance model that we've developed to implement the executive order that is very different from typical executive orders. An executive order is simply a directive by fiat for agencies to act in a certain way, to take a certain priority. And that certainly is part of this executive order, but we didn't just leave it there. We didn't just get an executive order passed and hope that it is implemented. In Albany, we passed the executive order with the idea that aging policy, health policy, was both a top-down matter, meaning we do need directives and resources on the state level from the top down, but perhaps more importantly, without a bottom-up component from counties and municipalities and community groups, we're never going to achieve our aging goals without that component too. So I'm going to talk a lot about governance and process. It's fascinating to me. I hope it is to you. Sometimes governance and process issues are boring, but I think it goes to the heart of why we are so successful here in New York with, with age-friendly New York. First of all, the executive order is very simple. Governor signed an executive order saying that all state agencies shall incorporate aging principles and health and public health disparity into all of their operations, their spending, their policies, their programs, even their procurements, their purchasing activities. And that's kind of a generic approach to executive orders. We then set up an interagency panel that brought together every single agency that even touches on aging and health. And we communicate regularly to ensure that our programs incorporate aging and health into them. Very important, because you include these principles in your programs. That sends a signal to the people who are applying for state grants and state money that they should be attuned to the needs of older New Yorkers and public health and public health disparities, because it may give you a competitive edge in generating grant money. So it's kind of a follow the money approach. And I'll give you a couple of quick examples of how we have done that on the state level. But more importantly, I'm going to bring it down to the county and municipal level. So top down, you give this executive order. Then you look at all your programs and you figure out where you can emphasize healthy aging. And the one program that I think illustrates the benefits of the executive order the best is the governor's Downtown Revitalization Initiative. It's a program that provides $100 million a year. Each region picks a winner, picks a downtown that wins $10 million each to revitalize their downtown. Now, what does that have to do with aging and health policy? Well, quite a bit. First of all, downtowns are inherently more walkable and bikeable and transit friendly, so people get out more and they exercise more. Downtowns provide an opportunity for access to fresh, nutritious, and even local food. So it overcomes that food desert phenomenon. When you have a mixed-use, dense downtown, you also have access to health services, to volunteer and civic opportunities, to day-to-day activities where you don't have to be entirely dependent on your car. And older New Yorkers are consistently showing a preference for walkable, bikeable, transit-friendly, dense, mixed-use, vibrant downtowns. So a vibrant downtown inherently is good for aging and public health. But we went a step further in the program, which is implemented here at the Department of State, and actually put aging principles into the grant solicitation. When you apply for this $10 million grant, for example, we ask a question in here: are you on the road towards becoming an AARP certified age-friendly community? And why is that important? Again, as I said, follow the money. If you're applying for money, you may be inclined now to say, yes, we are on the road to becoming an AARP age-friendly community, or we promise that we will, or we will incorporate principles of healthy aging into our grant application. So aging and health become ubiquitous, and hopefully you can't avoid it after a while. And any grant applicant, especially for a $10 million grant, is going to consider and incorporate these policies. We ask about access to fresh food. It's a central component of downtown revitalization. And we ask about it in the context of health and healthy aging. Are there alternatives to the car? In other words, is your community walkable, bikeable, transit friendly? Do you have a complete streets policy in your downtown that would make it easier for everybody to get around, but particularly older New Yorkers? Broadband accessibility. We ask about access to cultural, entertainment, and academic activities, very important to older New Yorkers. We ask a bunch of quality of life questions that go directly to the age-friendly New York executive order. So that's how we handle this on the state level. That's the generic approach to an executive order. Make sure it's ubiquitous. Make sure we're thinking about aging and health in all of our agencies and our programs. But the other levels, the multidimensional nature of the way we're handling this, and Tompkins County's involvement in this, I think is what earned us actually the National Public Health Innovation Award from the National Public Health Institutes in 2019. And it was this collaborative, top-down, bottom-up, vertical, horizontal, public-private, intergovernmental, I know this is really confusing, but it works, approach. In other words, come at aging and public health from as many directions as you can and deliver this on the local level and not just the agency level. So get away from me and all the agencies, Department of Health, Department of Environmental Conservation. Put that aside for a moment. What we needed, as I mentioned earlier, was a bottom-up component. Unless counties, and we picked counties for a very good reason, they tend to sit in a supportive position, a position where they can provide technical assistance to their municipalities. They've built relationships with local governments. So we felt like the county was the place, was the seat for a grant program that we called Age Friendly New York Smart Growth Grant Program. We took money from the Smart Growth Fund that I oversee, gave grants to a number of counties, including Tompkins County, to basically emulate what we're doing on the state level. So if the state is displaying good behavior, for lack of a better term, good policy on aging and health, we felt that the localities needed some help buying into that. So we gave out grants, and let me back up a moment. When I say we, here's the public-private component of this. We went out to the Health Foundation of Western and Central New York and asked them if they'd like to participate in this grant program. And not only did they say yes, but they nearly matched the $1 million that the state put on the table. So I don't remember a time when a private entity, a philanthropic entity, and a state agency actually married, came together, put out a solicitation. We had to do them technically separately for procurement and spending reasons. Our lawyers told us that. But in the end, we had almost $2 million to give out grants to counties to do one of two or both of the following. That is to emulate, to adopt the executive order that the governor passed, so that counties and municipalities are applying the same principles that we are here in state government. You want that match. You don't want a disconnect. You want alignment all the way up the line from the municipal, county, regional, state level. It's rare in state policy, but we've achieved that. The other thing that you can get a grant for is to do a plan to become fully certified as an age-friendly community by AARP. Or ideally, you can do the both of them together. So there's the bottom up. Now there's also what I would call an inside out or a horizontal component to this. And that's where we did not want to just give out one-off grants so that several municipalities, several counties could be age friendly. We wanted what I would call an exponential effect. We wanted to leave behind an entity, people with institutional knowledge that can, for lack of a better term, handhold, can help other communities that did not receive a grant become age-friendly certified and healthy community. So we created centers of excellence. You probably know that this governor is a big proponent of regionalism. We do sustainability, climate change, and economic development policy on the regional level. Well, this is just another manifestation of it by creating 5 centers of excellence. I believe Tompkins County was funded by the Health Foundation. A couple of other counties downstate were funded by my grant program. And what we want to do is leave behind a system that can, a technical support system that can help other communities get age-friendly certified so that New York can climb up the ladder in terms of the number of communities that are age-friendly certified. We're the first state to be certified. I think last time I checked, we're 4th in the nation on the number of municipalities that are certified. And I think with this grant and with this exponential approach that we're taking, that will accelerate and proliferate certification on the community level, I think we're pretty close to getting up to the 1 or 2 range. So that's how we're implementing this. There's grant money to match an executive order. There's bottom-up support to complement the state executive order. We have grant money, and ideally there'll be more grant money, but even if there isn't, we have a system set up and a partnership with a major health foundation, the New York Academy of Medicine, that we believe creates a mechanism, a unique mechanism that other states can emulate to become fully age friendly. And I'm just going to end on one note because it strikes directly at my job as the Smart Growth Director. We promote in Smart Growth good planning. One of the goals of Age Friendly New York was also to bring together the different parties to the table in a collaborative setting to address aging and healthy aging holistically. And in particular, we wanted the planners at the same table with the health and aging officials on the local level. They don't often communicate with one another. We wanted to create a table, a big table, in which they would. And we certainly see that type of collaboration in Tompkins County and several other counties where smart growth, i.e. the planners, are at the same table as the people out in the field doing implementing aging policies and programs and health policies and programs. So a lot of moving pieces. I've suggested to my colleagues that we put together an infographic that can demonstrate what I said in words, because it might come across a lot more clearly, but it is a complex and collaborative approach that we've taken, and we think that it's one that other states can learn from.
Fantastic. Thank you so much, Paul. And I'd like to, before we move on to the next presentation, I'd like to thank you for your long-term leadership on this. You know, for a lot of people, they're just hearing about these programs and they seem new, but these programs are actually decades in the making. So thank you so much. Thank you for your support.
It's been an evolutionary process.
Yes, great. So now I'm going to turn it over to Dr. Mildred Warner from City and Regional Planning at Cornell, and she and her team will discuss the large body of work that they have been doing over the past year on age-friendly work. Thank you, Mildred.
Thank you very much, Esther. We look forward to presenting here today. Dr. Shui Zhang and I and the team of students and active community members, Wilma Lawrence and Beth Harrington, will also be presenting. So I want to shift the framework. We've been talking about older adults, and an age-friendly paradigm includes everyone: children, working age people, and older adults. And we make a mistake when we say that age-friendly is only about older adults. So I want to shift our frame to an inclusive all ages approach. Second, we've been talking a lot today about planning and design, and I want to also give equal attention to services and participation. Smart growth will not get you to an age-friendly community. It's only one step. And it's a step that turns out to be very difficult, especially for rural communities, to take. So what we need to do is focus on inclusive design, shared services, and building a common vision that includes everyone, not just older adults. And to do that, we need to build new institutional partnerships, and we particularly need to address the urban and rural divide, which is something that we've seen in our Tompkins County work. So if you think about the capabilities of people over time, you get born, you learn to walk, you get your bike, you get to take public transit, you get your car, your driver's license, and then at some point as you get older, you maybe give up that license to drive. And so there's a functionality curve over the lifespan. And smart growth can get you so far in creating a community that's more walkable, that's safer for young children at one end and for older adults at the other, but it can only get you so far. And service provision has to make up the other two ends, and that's especially important at the two ends of the life cycle, which is why we need to pivot from just a focus on smart growth to a focus on both physical design and services. Now, we've been running national surveys of age-friendly, all age-friendly planning and services since 2013. And so what I wanted to do briefly was just give you a picture of where we are as a nation. We've been doing this work with the International City County Management Association. And the surveys address issues of the built environment and zoning at the street, neighborhood, and community level. It looks at plans, comprehensive plans, economic development, transportation plans, and emergency plans. And then it looks at services, particularly services for the very young and the very old. And it measures 29 of those services, and it looks at cross-agency partnerships. We also address the governing board of the community, the level of engagement of families with children, youth, and seniors, the barriers, motivators, and attitudes. And what I want to tell you is that our built environment has not improved since 2013 to 2019. What we see is that the majority of communities report being at the low level in terms of their street, their streets being having sidewalk systems, bike lanes, or complete streets. And the majority of communities report being at the medium level, which means 25 to 75% of their community is covered with access to neighborhood schools, parks within a half mile, public gathering places, a mix of retail and fresh food markets. So we've got a long way to go in making our built environment more age-friendly. With respect to zoning, that's what sets us up for the future. If you're a community that's lucky enough to have growth pressures, and many rural communities in New York are not experiencing growth pressures, but if you are, your zoning can help you get to a better future. And here again, we see that in zoning at the street level, more communities reported having less than 25% of their community covered by age-friendly zoning codes in 2019 than did in 2013. So it's actually, we haven't made progress on zoning at all. And the neighborhood issues have stayed pretty much the same. The neighborhood ones are looking at things like density bonuses, allowing childcare centers in residential zones, promoting parks and recreation in all neighborhoods, allowing mixed use. Planning also has a long way to go. We see that emergency plans are most common, partly because they're required by FEMA, but only half of them address the needs with families with children, and slightly more, 57%, address the needs of seniors. And if anything, Katrina taught us that you need to pay attention to both children and older adults if your plans are going to, if your emergency plans are really going to respond to your most vulnerable populations. 81% of communities have comprehensive plans. Only half of them address the needs of children or seniors. And economic development plans are the least likely to address the needs of children and seniors, less than a third. The barriers, lack of funding, segregated funding streams, these are some of the big barriers, and those are ones that Paul Byer with his program is trying to address. But what's interesting is that more places were reporting lack of information. And this is a good thing because it means they've become sensitized to the issue that planning for all ages is important, and they want to find out more information. What we find down at the bottom of this chart is a lot of people will say, oh, we can't do this because there's liability concerns or there's regulations that don't allow you to do this. And actually the communities that want to do it can make it happen. They can push through regulations and opposition. Those don't tend to be barriers that matter. So what leads to change? Number one, engagement of seniors and families with children. And that's part of what the Tompkins County Age-Friendly Task Force was doing last spring, having regular meetings and involving people who cared about these issues to help us move forward. And then it was also created a forum for community leadership and collaboration across agencies, all the agencies that were sitting around the table. And what we see in our national survey results and our analysis of it is it's this kind of transformational leadership coupled with engagement leads to policy change in your plans. And that leads to changes in your zoning, and it gives you better outcomes for your built environment and housing. But you also need collaboration if you're going to address the services for children and elders. So is age-friendly progress stalled? Unfortunately, it is at the national level. We're seeing more progress in streets and transportation, less in neighborhood and housing. And we need to provide more information and training such as this for planning boards. But we also need to address the urban bias in age-friendly designs, which leave suburbs and rural areas behind. And that's part of what we're going to be doing in the work that the students will be presenting here in a few minutes. We need an all ages approach. Collaboration is especially important, and we are happy to have been able to work over this past year with the Tompkins County Age-Friendly Center of Excellence. And with that, I'm going to turn it to my colleague, Dr. Jung.
Thank you, Dr. Warner. Now I want to talk about our excellent collaboration between Cornell and Tompkins Age-Friendly Center of Excellence. And this study is funded by Engage Cornell. And from Tompkins County, we collaborated with Terry Rindman, Lisa Marone, and Esther Greenhouse. And from Cornell side, this team is led by Dr. Warner. And also we have our excellent student interns working on different programs. We have Grace, Lynn, and Robin reviewing plans, conducted interviews. They will present their research later. We also have student interns, Katrina, to work with Child Development Council on services for child care providers. We also have Jake and Savannah working on mapping Tompkins County, and also Jeremy Xu working on response to food access during COVID. This project was started last year from June, and we have been attending Tompkins County monthly meetings. Next, please. And now I want to briefly introduce our project. We have analyzed the plans for OAG service in 13 municipalities and Tompkins County. And students interns has evaluated comprehensive plan. They have developed an age-friendly framework, the flower you will see later. They also reviewed comprehensive plans for all the towns, villages of Lansing and Cayuga Heights and Tompkins County. And we also conducted 15 interviews, which helped by Terry Riemann with planners, Tompkins supervisors, and services providers. And we also have Tompkins County mapping. Next, please. So now I want to briefly show you Tompkins County. As you can see on the left side of the map, it shows population density. We can see that people are clustered in Ithaca County and the villages, including Trumansburg, Groton Village, and Dragon Village. And on the map on the right side, it shows which communities answered the survey. So far, we got 13 respondents. We're still missing the respondents from Lansing Village, Cayuga Heights, and Dryden Village. Next slide. And in this slide, you can see the built environment. On the left side, it shows the level of walkability and mixed-use neighborhood. And the elements in here has been talked by Dr. Warner. And we can see that most of the built environment features are clustered in Ithaca City, Trumansburg, Groton Village, and Freeview Village, where it has a lot of population density. And what we found that the built environment concentrate in city and villages, but Tompkins County municipalities lack of bike lines. And on the right side, you can see the features about housing and child care. The most common features are rental housing, which has adequate supply by a lot of municipalities. But what we like is the senior housing, affordable housing, and affordable quality child care. Next slide. And in this slide, you can see the zoning code. On the right, you can see the map. Compared to built environment, zoning code are covered by a broader municipalities. And on the left side, you can see the most common zoning code allowed by municipalities in Tompkins County are allow accessory dwelling unit, allow family-size housing, allow child care center, although Tompkins County lack of quality and affordable child care. Also, one of the most common zoning code are promote park and recreation facilities. But on the other side, the least common zoning code allowed by municipalities are mandate universal design, provide density bonus, mandate sidewalk system, and require street connections. Next slide, please. In this slide, you can see the 30% of municipalities provide different variety of services. And above the horizontal line is the percent of services provided by Tompkins municipalities higher than our national survey. And you can see on the top is after-school programs, home delivered meals or groceries for seniors, and summer camps. But on the bottom part of this graph, you can see the percent of survey provided by Tompkins County, which is lower than our national average. For example, the community center share by ages. Also at the bottom are business assistant, loan and grants to support children, and senior workforce development programs. And the lower part calls for actions. And this slide shows the cross-agency collaboration. In Tompkins County, most municipalities collaborated with school districts and libraries to deliver services for children and seniors. And our student intern going to talk more about the collaboration. And I want to pay attention to that the economic development and not collaborate much with local government to deliver services for children and senior. And also the hospital childcare providers and childcare resource and refuge agencies are the least other agencies that only a few of communities had that to collaborate with local government to deliver services. Next slide, please. Now, in this table, we can see the plans. Tompkins County has all the plans: comprehensive plan, economic development plan, emergency plan, and transportation plan. And the comprehensive plan and the emergency plan pay attention to the family with children and senior. And on the right side of the table, we can see the plan in Tompkins municipalities. 100% of municipalities has comprehensive plan, and about 69% of them has transportation plan. And for the municipalities with a comprehensive plan, 50% of them pay attention to the family with children and senior. Also, about 38% of them pay attention to the need of women, which is higher than our national survey result. And for the transportation plan, about a third of municipalities pay attention to address the need of family with children and senior, and only 8% of them pay attention to the need of women. Now I want to turn attention to our excellent student interns to talk about their research on evaluating the Tompkins County's municipalities comprehensive plan.
Thank you, Shui, and good morning. Before I jump in, I'd like to thank our hosts, Lisa and Esther, for having us this morning. We are really happy to be here. This is the beginning of the student portion of the project, and after we wrap up, we'll hear from members of the Caroline community. My name is Grace McCartney, and I'm joined by my colleagues Lincoln Wu and Robin Wardell this morning. I will begin by talking a bit about how we approached this work, the framework we used about thinking for age-friendly, and the data and information we used to progress through the analysis. Then Lynn and Robin are going to share our main takeaways thus far by outlining the themes that came through from our cross-case analysis. Next. The essence of our work was gathering information about current assets of age-friendly services, programs, and infrastructure, with the goal of figuring out just how age-friendly communities in Tompkins County are. We used 3 types of information to conduct this assessment. We began by reviewing comprehensive plans that municipalities have adopted, and then we looked at the survey results that Dr. Zhang and Dr. Warner just discussed. The survey was filled out by 13 municipalities in Tompkins County, so we were able to get a localized slice of that data. And finally, we conducted interviews with community members in each municipality. These 3 components of information offer what we hope is a well-rounded sense of the age-friendly reality in each community. All this information was analyzed through a framework we developed last summer, and I'm going to talk a bit about how that framework came to be. Slide. We developed a framework by comparing key areas of interest of different organizations. We included UNICEF because of their mission towards protecting children. We chose the World Health Organization because of their efforts towards considering all stages of life. And we chose AARP because of their national advocacy for seniors. We also compared it to the initial set of items used by the Tompkins County Age-Friendly Center. These organizations cover a huge span of interests globally, nationally, and locally. Each organization has a set list of attributes that they believe age-friendly communities embody. We wanted to consider all of these characteristics they outline in order to have a well-rounded lens of age-friendly, one that included both children and seniors and everyone in between. However, after combining all these lists, we had too many levels to review the municipalities by. Our solution was to create a framework of domains that encapsulated all the ideas without having the redundancy of having each item stand alone. Slide. This is the list we ended up developing by combining the different attributes. They're grouped into 3 larger categories of community, services, and land use. Under community, there's civic and social engagement, communication and information, respect, inclusion, and trust, business and work opportunities. And then under the land use category, we have housing, neighborhoods, built environment, open spaces, and recreation. And under the services category, we have education, health services, childcare, other services, and transportation. We created these subdomains to help us look for crucial aspects of these three categories, but the subdomains are not firm, and it's common for comprehensive plans to discuss facets of their communities that transcend our boundaries or emphasize just a few in particular. For example, we found that many different comprehensive plans will emphasize transportation either as a service or a land use issue. So that topic commonly occupies more than one petal on the flower, and throughout our analysis, we saw emphasized in different ways depending on the community. Slide. As you saw, the flower groups different aspects of analysis into three broader categories. In addition to accounting for overlap situations like transportation, the flower also accounts for collaboration. Collaboration among agencies, organizations, and offices was not listed as any of the attributes in the age-friendly community list by AARP, UNICEF, or World Health Organization. The missing domain of cross-agency collaboration is in the center of the flower because it holds together all the efforts put behind individual petals. For example, in order for the built environment and childcare petals to have the most impact, they need cross-agency collaboration. Framing these planning elements as a flower allows us to focus on the central part, and that is cross-agency collaboration, because it overlaps with everything, and age-friendly planning is incomplete without it. We found that cross-agency collaboration was crucial in bringing these different aspects and views of an age-friendly community together into reality. Slide. There are 16 municipalities in Tompkins County, and we started our analysis by looking at the communities on the town level, and later evaluated villages, the city, and the county. We decided to start our analysis by focusing on the most rural type of municipality in Tompkins County, because well-established frameworks for age-friendly communities already exist for urban areas. There's not as much research, much less a universally agreed upon framework for rural age-friendly. While these 9 towns and their plans are quite different from one another, and even more so from the villages and city, we did pull out some common themes which we will elaborate on. Slide.
So I'm going to start some of the themes that we found in our cross-case analysis, looking at these different municipalities. I'll talk about the urban and rural differences, the role of municipalities and planners in trying to reconcile some of the problems, and the role of school districts in community cohesion. And then Robin will talk a bit about access to services across all the municipalities, and end with some general conclusion about cross-agency collaboration and its importance in age-friendly. Next slide. So a lot of comprehensive plans have a focus on land use because a lot of comprehensive plans are by their nature focused on the physical aspects of a community. Some things that we found throughout all of the municipalities is that there's a need for senior housing and affordable housing. Affordable housing more so towards the center of the county near the city of Ithaca. Another significant issue was aging housing stock, particularly retrofitting houses, especially for aging in place, in that when people want to stay in the same place, they might need a lot more accessible infrastructure, either in their house or outside their house. But the accessibility outside their house is very tied to density, and that in a rural environment, that is not as easy, or it's not as prevalent to have a lot of density. And transportation is a big part of this, in the sense that a lot of pedestrian bike infrastructure is a focus in a lot of these comprehensive plans. Next slide. So looking at rural age-friendly communities specifically, we can see that particularly services and community cohesion are essential for age-friendly, and they kind of fill in for the lack of density to create a rural age-friendly community. The increased housing density in some of the hamlets could create opportunities to build age-friendly planning into the physical space, but where that's not possible, services and community cohesion can help to mend that. But it's more important too that the services and community are also integrated into the physical land use planning where they do exist in the more dense villages or hamlets. As I said before, it's also very dependent on transportation. particularly because rural transit is limited and transit is often directed towards getting to work, particularly in the case of Tompkins County, towards the city of Ithaca. And a lot of rural places might not get more than 2 bus trips in a day, which makes it difficult to access services or services, community, groceries, and other things that become more of a problem. Next slide. So I want to start by kind of looking at an example of a town that deals with some of these issues in rural age friendly very well. So the town of Ulysses is a town in the northwest of the Tompkins County. It's next to the village of Trumansburg, but they work very closely together. The hamlet of Jacksonville, which is shown here in this gold color, creates a proximity to goods, services, employment, and transportation. The town is looking to locate high density housing like apartments and senior housing complex in these areas and other multi-use nodes. And they're trying to rehabilitate this area to encourage residential and small scale development and kind of focus any growth in a particular area to preserve the rural character in the rest of the town, while still creating this dense area where people of all ages can access services more easily. This also includes expanding their transportation options, like adding bike racks at bus stops or exploring park and ride locations, and trying to create more sidewalk systems to connect to the village, especially in the yellow areas near the village of Trumansburg. This is all the great stuff that the town has been doing, but what was striking is how much of it was through collaboration, and particularly the town of Ulysses collaborates with the village of Trumansburg, and they also collaborate with a lot of other boards, such as the school district and Trumansburg Community Recreation Board. This is the 4 boards that they kind of talked about in their interview. But this doesn't mean that they're always in agreement, but it does mean that collaboration across any interest help them to move across silos or different domains of thinking and try to bridge the gap between different aspects of planning. So through this intercorporation, they can share youth services, health insurance, police services with the village, and encourage intergenerational programming throughout the town to kind of bring the services to people in rural areas. Next slide. The role of Hamlet specifically is something that I want to focus on, in that aging in place is possible in some places because of the transportation network. So for in Lansing, which is near the developed areas of the city of Ithaca, there's a very robust transit system that allows people to live and age in place because they can take very regular transit to where they need to grocery stores. But in this case of Caroline, which is a much more rural rural town, it's a lot harder to get use the transit system only, and it's hard to rely on driving, especially if you're very young or very old. And nodal development is encouraged as a way to kind of deal with this and to encourage this, to allow for aging in place while preserving the rural character of the town. And towns with villages would focus on their villages as the center of development, but even without, or even towns like Ulysses with a village of Trumansburg still focused on hamlets as a essential part of connecting the different parts of the town to each other. The reason that the hamlets are important is because they're places where you can integrate land use and services. And this is not because the hamlets attract residents who want to live there or attract older residents who want to live in a rural area, but more so because they're the place that they can actually integrate land use and services in a rural context. So in some sense, the most of the focus of a hamlet and the role of a hamlet is in helping people to age in place without moving to senior housing in a more urban environment. Next slide. And the other part of a rural country that is important is the community cohesion. Through our interview with key informants, it's clear that community cohesion and identity is very important for ensuring a sense of trust and ensuring open communication and spreading information between people and the local government. So again, like this is a broad thing that a lot of the rural areas like. And sorry, again, this is the center of cohesion is important to a lot of rural communities, and they're not necessarily only done by school districts. It's just that I would like to focus on school districts in this talk. We also looked at libraries, fire halls, and other community events, which all provide this space for community programming. But the importance of a school district in this community building is that they provide a hub to connect people to programs, particularly to young people. So a lot of youth programming exists in the county, which operates on a town-based level. And a lot of them source their participants from schools, try to engage with the schools to create programs and work with the school in education, but also to use the school spaces for community programming for both the convenience of transportation in rural areas and for using the space that might not be used otherwise after school. The reason that schools and libraries are very important in this community building is because they're yes organizations, which is to say that they say yes to collaborating with things, and they try to find ways to expand their services and expand the programs that they have. And particularly libraries are key in this cross-agency collaboration project because they might be one of the few secular civic hubs in rural areas, if not the only one. Next slide. So particularly in terms of school districts, a problem that we encountered was the consolidation of school districts. There are many challenges that community groups face, like transportation to civic hubs is difficult, but one of the bigger themes that we saw across several towns is that towns that don't have a school district, or the towns that don't overlap perfectly with a school district, can have some problems in terms of creating this programming and the sense of community. Particularly, it creates a lack of identity, but also creates a mismatch of program targets. So in this example, we are looking at the town of Enfield in the west of the county. The town of Enfield is divided between the Ithaca City School District and the Trumansburg District. And this means that if for the youth programming that is limited to the town or in their scope and funding is limited to the town, to find people to join their programming, they have to go to 2 schools, and they also have to figure out which kids are in the town of Enfield or live in the town of Enfield. And that might not necessarily, that also comes into conflict with if the kids have friends who are not from the town of Enfield within the same school. And this means that the youth programming has to spend a few more resources to try to create this cross-agency collaboration. So if I go back to Ulysses for a while, the town of Ulysses is fortunate in that most of the town is served by a cohesive school district, the Trumansburg School District. And because of this, they can collaborate more directly with the school district and create these programs that really work through intergenerational programming and through education and partnering with school. But for Enfield, they have to try to overcome some of these barriers by, for example, they're currently in the process of purchasing a community center to try to create a space for community planning that isn't reliant on the schools, but also they do require more resources to try to find all the kids that they need for the program and try to create this sense of identity, create the town of Enfield's youth programming that transcends these different school districts. This isn't unique to Enfield. This also occurs in a lot of other towns that don't have their own school district. But the fact that the school districts are fractured in some towns is difficult because it means that they cannot disseminate information about upcoming opportunities from one single location. With that, I'll turn it over to Robin, who will talk a bit more about access to services.
Great, thanks, Lynn. So you've probably all heard a theme reverberating throughout our presentation so far that services are really important, especially in rural communities where land use planning is not necessarily the primary tool for age-friendly work, but it's definitely an important tool in the toolbox, but really bringing these 2 things together became increasingly important in our minds from one interview to the next and from one comprehensive plan review to the next as well. We also found that access to one service can have a domino effect onto others. So if you live in a rural town and you don't have easy access to internet or your cell service is spotty, then it might be hard to get an accurate bus schedule to take into town to access health services or go to your doctor's appointment. So it's important to think how one service is connected to another. In rural areas, there's also a really heavy reliance on volunteerism to provide a lot of these services. Even though they have an outsized importance in these smaller towns, by nature of being a smaller town, staff is at more limited capacity. There aren't as many institutions that are located right there. So there's a pretty heavy need for people to step up and provide things like emergency food distribution, emergency medical care, volunteer fire departments, things like that. And we found that access to services varies really widely across the county, not only in terms of physical access to different kinds of services, but also in terms of funding, which we found is that funding for different kinds of services is kind of bifurcated between the city of Ithaca and more rural towns across the county. And it also really varies depending on one's income level and their ability to live in more central parts of the city or the town that they're living in. Next slide. So one of our colleagues who's not here with us today did a really great study looking at some mapping of Tompkins County and understanding what some of the resources are within the vicinity of different kinds of senior living centers. So this map shows us both market rate and subsidized senior living, and the blue circles represent a buffer around the market rate senior living centers, and the tan yellow circles represent the buffer around subsidized senior living. And so what he found is that market rate senior housing is primarily located in Ithaca and Lansing, and subsidized senior housing is kind of more dispersed across the county. So then he looked at access to different kinds of services. And the first that we'll look at here is pharmacy accessibility. And we found that pharmacies are concentrated in Ithaca, Lansing, Dryden, and Trumansburg, whereas other outlying towns don't have access to a pharmacy. So this really underscores the point that delivery services to rural areas might be an important thing that we can help to support and grow, given that people might not have as easy access to sorry, I just got a pop up, might not have as easy access to physically to access those other services. Next slide. So the next piece is access to grocery stores. And here we see pretty clearly that market rate senior housing is more likely to be near grocery stores and amenities than the rural subsidized senior housing. So again, this underscores the importance of things like delivery services or connectivity via transportation services to get to these different areas, which is what we will look at next. So this map shows us the connectivity across the county through TCAT routes, and they reach most of the senior living centers that are on our map, but the frequency and timing and lack of bus shelters can undermine its effective use, especially in some of the more rural areas where it's a little bit less consistent, and the span of the schedules over the course of the day is a little bit more contracted. So these maps show us that, again, delivery services are really important. Your ability to live in market rate versus subsidized senior housing has an effect on your service, your access to different services. So we wanted to highlight a town that's doing a lot of work around providing services to its residents, despite being in a little bit of a distance from the town of Ithaca. So the city of Ithaca. But the town of Caroline has kind of seen a shift over the course of the last few decades in terms of starting out as more of like a logging and farming oriented community towards becoming more of a bedroom community for the city of Ithaca. And so the needs have changed around services. And one thing that came out very clearly in our interview is that cell and internet service is a constant issue in the town of Caroline and is really limiting in terms of making it possible for people to come together to participate in various programming and to access information that they need to go about their lives. So the town is partnering with other municipalities across the county and with the county to try and advocate for better cell and internet service in the town. I also mentioned the kind of changing demographics of the town of Caroline, and that's changed the way that people need to access transportation in the town. It's really increased car traffic, and made it so that the town has tried to increase carpooling and park and ride services to make it easier for people to get in and out of the town without kind of compromising the rural character and small town feel of the place with a lot of traffic. And lastly, they talked a lot about the importance of volunteerism for delivering things like food distribution, for running the volunteer fire department, and for providing emergency medical services. And they did cite that this is also a challenge in a rural place because they are relying so much on volunteerism to make these services possible for people. But recruiting volunteers is becoming increasingly difficult. And especially during COVID, when a lot of volunteers are seniors, people didn't feel comfortable actually participating and providing those volunteer services. So that limited the scope of what they were able to provide even more. So we've touched on this a bit throughout the presentation, but at the center of this flower is cross-agency collaboration. And that's kind of the glue that holds all of these things together and reminds us that the way that we approach community and land use and services really augments one another when they're working more in concert with one another. So we found some common silos as we were going through our interviews and plan reviews. And one is varying interactions amongst different tiers of government and also with service providers. So communities that were really proactive about interacting across county to town to cities with local organizations and institutions were able to provide an increased level of service and respond to community needs in a different way than those that had less interaction. We also found a pretty clear separation between youth and elder services. Mildred mentioned this earlier, that oftentimes when we're talking about age-friendly, we think a lot about elder services, but in truth, the youth and elders need similar services. And so bringing those things together can really exponentially improve the services that we can provide for both. And it also is really beneficial for both parties to have more multi-generational, intergenerational programming and opportunities to interact. We also saw some really great examples of collaboration. I mentioned the example with the internet in the town of Caroline, working across different levels of government and with community organizations towards a common goal. And one of my favorite quotes from one of the interviews that we did was, again, our interview with the town of Caroline, when we were asking about the presence of cross-agency collaboration and if there are any major silos within their areas of work. And someone spoke up and said, well, what's a silo? We don't know what that is in a rural town. There aren't enough of us here to make that possible for us to be overly specialized in our work and to not have all hands on deck all the time. So I think that was just a really poignant phrase to me, that in a rural town where you obviously see a lot of silos on farms and doing what a silo is meant to do, in terms of work, that isn't really something that exists. So just some takeaways and recommendations. We really, again, found that the physical planning and the service provision can work together to make communities more age-friendly. And the rural and urban approaches don't have to look the same. One size does not fit all, and they really can't look the same if we're going to address the needs of seniors and young people in all of our communities across the county. And collaboration across sectors and areas of work help to hold all of these things together and make it possible to make our communities places where our youngest to our oldest members can truly thrive. So to bring some of this to life, we're going to invite Will Lawrence and Beth Harrington to share some examples of their own advocacy around age-friendly planning in the town of Caroline.
Hi, I'm Will Lawrence from the town of Caroline, and I will be giving the presentation. This presentation was much improved by Beth Harrington, who brings decades of experience as a volunteer in community organizations and also in emergency response. I'd also like to acknowledge our town supervisor, Mark Whitmer, for his willingness to say yes to something new. Next. So as you know, rural areas are dependent on their volunteers for many of their services, for their boards and their committees. And for me, the age-friendly process pretty much started with a picnic with a group of seniors. Mark came to the picnic, and on a whim, I asked him if I could be on the town board agenda every month to give a 5-minute update on seniors, and he said yes. So while I was volunteering at that point, I was going to lots of presentations and workshops and having friendly conversations with experts. The point I'd like to make is that as a volunteer, I had access to expertise from several organizations. The flip side of that is, of course, that several organizations are giving that access, that there are lots of free workshops and presentations, and people are giving their time for those conversations. I also want to suggest that ordinary citizens are also local experts, that they're a source of a lot of information that is not documented anywhere. So talk to your local experts. Next. So it started with a picnic and then a resolution, and I went to a lot of planning board meetings, and as it turned out, the planning board was in the process of revising the comprehensive plan and creating a livability section. So that was very opportune. And I was able to take the information I was receiving and use it as a way to describe trends. So I could take Dr. Warner's survey, use it as a framework for talking with my town supervisor, and I could show up at the town board meeting and give examples of what Esther Greenhouse had described as building an environment for livability throughout the lifespan. So these were conversations about trends. Next. So we have an age-friendly action item in our comprehensive plan, create residential development guidelines that include neighborhood preparedness, resilience, and age-friendly community design principles. I am hoping that as we move forward, because we're ready for action now, that we will concentrate on the resilience part, and in particular, in the sense of building some infrastructure now so that we have the ability to recover from any kind of unexpected economic downturns or uncertainties of the future. What I'm hoping we will focus on is emergency preparedness neighborhood groups. And I think that the Center for Excellence has really documented how vital having existing social infrastructure is. During the pandemic, when it was used for delivering food and services to community members in the outlying areas. I also want to say that it's really heartening and reassuring to see social infrastructure and the needs of rural communities brought into the conversations and put among the topics that are more typical for planning and zoning. Next. So to be a voice that's heard, you need to know your community, local politics, of course, speak up, be persistent in that, know your local government, it's changing all the time. And what I really want to emphasize is the need to extend your reach, not just to reach out and find out what other people are doing in other municipalities, but also to reach out to people who might not otherwise be inclined to speak up, but to reach out to them on your own and find out what they know about your local community. And that's it for me.
Thank you so much for sharing all of that, Wilma, for your perspective, and then to everybody on the Cornell team for sharing your extensive research. So lastly, Mildred, I'm going to ask you to stop sharing screen so we can move to Q&A. And I'd like to acknowledge that we are going over time. If you are able to stay, whether you're an attendee or a panelist, please do so. If you cannot, we completely understand. So I'd like to ask if any of the attendees have questions, please type them into the chat. And also, I put in my email address. If anybody wants to follow up with an email, I'll do my best to get the questions answered.
Hi, Esther, it's Lisa. I'm not seeing anything in the chat at this point or the Q&A section.
Great, thank you.
Mhm.
Okay, well, then we're going to wrap up. Again, my email address is in the chat if anyone wants to follow up with questions. And I'd like to thank our large array of panelists who represent from the state level to the grassroots level, who've done a variety of work that have been contributing to making Tompkins County age-friendly. So thank you so much for participating, and thank you to the presenters for sharing your expertise, insights, and experiences.
Thank you.
Thank you.
Great.
Thank you.
Thank you.
Thank you.
Everybody, bye-bye. Bye.
Thanks, Esther.